So if you've been referred to see a radiation oncologist in Thompson, that will involve you coming to meet a specially trained oncologist that has additional training in radiation that will describe to you the situation you're in, the stage of the cancer, review your specific case, and then we'll discuss with you the options as it pertains to usage of radiation to help treat the cancer. That typically involves a discussion regarding external beam radiation therapy, which is the most common type of therapeutic radiation used to treat cancer. That consists of patients lying still while a specialized machine rotates above them and delivers radiation to their cancer or to areas at risk of having the cancer come back. It's typically an outpatient appointment, and there are very customizable ways to deliver the radiation, be it different numbers of techniques that can be utilized. So the first appointment with a radiation oncologist is typically an appointment in which an assessment will be made as to whether or not the patient will benefit from radiation or may need to consider radiation. At that point in time, the radiation doctor would design a treatment plan for the patient and outline to them how many times they may need to come to radiation or what medicines may need to be given in conjunction with the radiation. After it's decided that radiation may need to be utilized, we will arrange for a specialized, what we call a planning session, or what we call a CT simulation. And this is an appointment where a specialized CT scan will be taken of the patient that helps us outline and map exactly how to precisely arrange the radiation target and the delivery method for the radiation. The CT simulation appointment is oftentimes a separate visit from the initial appointment with the radiation oncologist. After the CT simulation is done, that's where the real work from my standpoint and from our team's standpoint begins. We are working in the background designing targets for how to aim the radiation correctly and designing a patient-specific plan that helps us customize the radiation for the patient so that we, what I like to say, hit what we want to hit and miss what we want to miss. That process can take a week or so often, and there's a whole team of specialists in the background, including PhD physicists and people named dosimetrists that help us plan the radiation. And the final product, the radiation oncologist reviews the plan and agrees upon usage of the plan and signs the plan, and then the radiation begins. That whole process from planning to start of radiation may take anywhere from, on average, 1 to 10 days. There's a wide range of radiation doses and schedules that are utilized, and they vary dramatically between patient to patient and between different cancer types. So it may be as simple as one radiation treatment all the way to upwards of 40 treatments in different situations. And that is all very customizable based upon the patient and the type of cancer. At completion of treatment, there will often be follow-up visits arranged with the physician. Those can range from anywhere to come back and see the doctor a week later, all the way to a few months later. Oftentimes scans are to be ordered after treatment are complete, including CT scans or PET scans or MRIs, to follow up with regard to the result of the radiation to make sure things are evolving appropriately.